Right, so let's go on to the next case and look at this image. And this is a chest X-ray of an adult. Okay, I'm just going to have a drink of water. Right. Right, so we have got an adult patient, and we can probably infer that they're a bit older, I guess, because look at that acromioclavicular joint. There's a bit of osteoarthritis probably sitting there. The glenohumeral joints look okay, not much in the way of calcifications of the chest. Hyla, so let's have a look. So let's have a look at the lungs. So yeah, people have gone for it already, and yeah, that's fair enough, right? You can see that there is some abnormality located in it, but I want to give some of you guys a bit of a system. So obviously have a look at the lungs. If you haven't seen anything else, have a look at the lung apices as well, and have a look at the lung apices and see what you think. And actually, you know how last time um, there was that issue with, I have not heard the word pink puffer in a long time. Wow, that brings back a lot of memories. I'll go into that in a second. Okay, so you draw your little squares, and then you know the last case, what we saw was there was a lack of lung markings, right? And this time there is a lack of lung markings, but in a different way, in that there is now some sort of apical thickening located within that region, right? So there's something kind of dense within that region, right? And so one of the things I'll try and do is have a look at that area over there and say, okay, is it bone? Is it soft tissue? Is it lung? So because it's kind of dense, but doesn't look like bone, because bone looks like this, so it can't be calcifications. It looks like it's some sort of soft tissue abnormality, right? So you think to yourself, okay, well, actually, as someone gets older, you can get apical scarring. And that's very, very normal because you don't have as much blood flow to the lung apices. And then you can get scarring, and then that can cause a few issues. But with this one, in this particular situation, it's asymmetrical, isn't it? It's very, very asymmetrical in terms of how dense that is compared to there. Like if you went there, you could say, yeah, okay, there's a little bit of apical scarring there, but this is very, very thick indeed, right? So let's have a look at the rotation. Remember we talked about rotation? So that's that end of the clavicle there. That's that end of the clavicle there. And we can see that there is a sort of spinous process that is sitting over here. So that actually is pretty well centered, right? So basically, they're not particularly rotated. So that's not them being like this or like this. That's kind of almost on fast as best as you can get. And you've still got the sort of, you can't explain this away, right? Now, let's have a look at the hilum. That's the hilum there. Where's the other hilum? The other hilum's here. So this looks like it's been pulled upwards, doesn't it? So this looks like some sort of apical scarring going on, right? This doesn't look quite normal. A few people have said that do they look like hyper overinflated lungs? Yeah, I mean the lung, you know, after a while, it can be it can be. I think over time you start to kind of get an idea about what the lung markings should look like, and when they look a little bit porous or they don't look like as many lung markings as they should be, then you can start to infer that there could be some sort of underlying emphysema. Now, could this be a left upper lobe collapse? Now, usually when you do get a proper left upper lobe collapse, you do end up getting like a veil-like capacity or something along those lines. This one just looks very sort of wedge-like, and it looks like it's kind of almost solid. And the fact that, you know, everything's kind of pulled towards it. Look at that tracheus going towards it. You got your apica, you got your hilum going towards it as well. You've got to start worrying. So there could be something else going on there, and therefore this person would end up needing to go get a CT scan. And from what I remember, this person's still under investigation for this one. Is kind of a bit more hot off the press, this one. But I thought it was quite interesting just to kind of illustrate the rotation and the hilar, you know, being pulled up and all that kind of thing. And in this particular one, you don't have much in the way of the hemidiaphragm being pulled up, and that's what you'd get with a sort of a larger collapse and a larger sort of apical scarring and that kind of thing. Right. So yeah, so this is clearly an abnormal area. We can't explain it away. It's got apical mass, which is causing some tethering of the surrounding structures. It's causing a midline shift towards the left of the trachea, and it's causing, yeah, some left hilar elevation because towards it as well, which you can see. Look, that one there and that one there, the hilar completely out of line with one another. Right.